New videos every day.
I want to read you something. Section 1002, Individual Responsibility, lowers the flat payment from $495 to $325 by 2015 and from $750 to $695 by 2016, and raises the percentage of income that is an alternative payment amount from 0.5% to 2.5% by 2016 and subsequent years to make the assessment more progressive. Now, that particular quote happens to be from the analysis of the brand new Health and Education Reconciliation Act for Affordability of 2010. That current bill that all the hubbub's been over in the news lately, healthcare reform. Now, personally, I happen to agree that this country certainly needs healthcare reform. However, a bill that's going to be taking upwards of $940 billion out of American pockets, well, I don't necessarily think that's really the way to go about it. Now, what that quote I read to you really means is that essentially what's going to happen if you're currently insured by your employers or you're on Medicaid, which, by the way, if you're on either, you're already paying for them, an additional fee is going to be incurred in order to pay for those who are going to take part in the new socialized healthcare system. Now, also, if you choose to not get insurance, you will be charged. So essentially, you're going to be paying more than you already are on a weekly, bi-weekly, or monthly basis to add to this giant honeypot of socialized medicine. And I want to know what you think. So real quick, here's just a couple facts from the latest release of the Census Bureau about healthcare for you. Roughly 15% of the American population is on Medicare currently. That's about 45 million people, And as of right now, at least employees pay 1.45% of their entire income towards Medicare, while those who are self-employed pay closer to 3% of their annual earnings. The total population on government insurance, which includes Medicare, Medicaid, military insurance, the CHIP program, state health assistance programs, etc., was 87.4 million Americans. And this is where a large portion of your taxes are already going. Enrollment in the Medicare program is expected to skyrocket to 79 million participants over the course of the next 20 years. Right now, the number of uninsured Americans is roughly 46.3 million individuals. And here in Texas, currently, we are in a $1.7 billion deficit to do with Medicare. And adding to that, over the course of the past year, the number of participants on the Medicare program has risen by 11%, which is about 350,000 individuals. So what does any of that information mean? Well, basically, if you are insured currently, you can look forward to not only paying for the rising Medicare population, but also now you can double that number because we're going to have another 46 million people that are uninsured to add to this new socialized healthcare program. And secondarily, if you aren't insured, well, you can do one of two things. You can choose to purchase private healthcare insurance, can take part in Medicaid or some form of this universal healthcare socialization, or you can pay. But no matter what you do, insured or not, you are going to pay, and the government is going to make sure of that. Also, provided for in this bill was a new section for the Internal Revenue Services, which is just this. They have created an office that is now going to go through the annual income of each and every person, determine their current insurance coverage, and whether or not they are covered, how much to bill them on a percentage of their annual income each year. And don't think that you can avoid this by, let's say, not filing your taxes, because nationwide they will have field agents that will be able to come out and investigate what your actual income is. So, I wanted to keep the facts short, sweet. This is a very simple video because I really want to know what you think about this bill as a whole, about being taxed for socialized medicine more than we already are. And I just want your opinions in general. So please leave me all and any comments that you have about this particular issue. Rate the video and subscribe to Psychetruth to keep up to the date information. Thanks so much for joining us.
If you liked this video, we have hundreds of more alternative videos ranging from sexual health to psychology to mind control. So if you liked it, go ahead and click on me to enter the Psychetruth channel.